There are reports of outbreaks of a respiratory illness, mainly affecting children, from several countries in Europe apart from the US. These reports have alarmed many, especially since they are coming in days after a similar outbreak in China. In some countries, the identified disease has been called white lung syndrome, indicating that it may be a new condition. It has triggered concerns of other large-scale outbreaks in a world that has just recently battled COVID pandemic. Hello and welcome to The Print. I am Sumi Sukanya Datta, and in today's episode, I explain what is the white lung syndrome and if we should be concerned about it. Health authorities and clinicians in India maintain that there is no need to panic yet. They say that no new pathogen or disease-causing agent has been identified behind the recent surge in pneumonia cases. Experts told us that in China, the overwhelming number of pneumonia cases could be a result of infections. These could be due to a mix of influenza, adenovirus, and respiratory syncytial virus. There are reports of increase in mycoplasma pneumonia, which are known to cause atypical pneumonia or white lung syndrome. But white lung syndrome, as it is being called, is not a new disease and is only a symptomatic manifestation of a viral or bacterial infection. When we get chest X-ray or CT scan of the chest, the lungs being filled with air appear black in color, as it allows radiation to pass through without blocking them. If there is any infection or any other pathology like fluid in lungs, then that portion blocks part of radiation and hence causes a whitish impression on X-ray and CT chest. The white lung disease is actually a generalized term for acute respiratory distress syndrome or ARDS, which can be secondary to infection or can be secondary to any lung pathology. In fact, according to experts, any infection in lungs may be termed as white lung disease. It is not a medical terminology, but broadly represents lung pathology. Presently, it is widely used for pneumonia cases, which are being diagnosed recently in China, doctors told us. This is a highly contagious condition that spreads very fast in the community and hence causes a lot of fear among the public. But according to Dr. Kirti Sabnis, infectious disease specialist with Fortis Hospital in Mumbai, at present, white lung disease is primarily linked to viral pneumonia. It is often caused by flu or other respiratory viruses prevalent in China during specific seasons. White lung syndrome is marked by cough, fever, sweating, chills, and in some cases, shortness of breath. Experts say that kids aged 3 to 8 years of age may be more susceptible to it. Good news is, like cases of serious flu infection, patients of this syndrome in most cases can be effectively managed with appropriate medications and intensive care. Also, there is a vaccine meant to protect against pneumonia available, and this vaccine is particularly beneficial for individuals with compromised immunity or those prone to recurrent chest infections. But the question remains, do we really need to worry? On November 23, the Lancet Microbe published a report titled Mycoplasma Pneumonia, Delayed Re-Emergence After COVID-19 Restrictions. It said that the All India Institute of Medical Sciences in New Delhi had detected 7 cases of bacterial infection between April and May this year. But the Union Health Ministry has issued a statement clarifying that these 7 cases have no link to the recent surge in respiratory infections in children reported from some parts of the world, including China. The government said that the 7 cases have been detected as part of an ongoing study at AIIMS Delhi in the 6-month period and are no cause for worry. Its statement also stressed that since January 2023 till date, no mycoplasma pneumonia was detected in the 611 samples which were tested at AIIMS as part of ICMR's multiple respiratory pathogen surveillance. This surveillance includes mainly severe acute respiratory illness or SARI. According to the government, M. pneumonia is the commonest bacterial cause of community-acquired pneumonia and is a reason for nearly 15 to 30% of all such infections. Such a surge has not been reported from any part of India, the government statement also said, also stressing that ministry is in touch with state health authorities and is keeping a close watch on the situation on everyday basis. Experts also tell us that while there is no need to be alarmed at present, the country needs to be cautious to prevent its spread. They advise that we must continue to take precautions as whatever causal agent may be, these respiratory infections spread via droplets through air only. It may be therefore useful to wear masks and maintain social distance as far as possible, and it is also a good idea to practice hand hygiene and get annual flu shots. Thank you for watching.